Hello dear all. So in this lecture on Egyptian medicine third part, we discuss about father of Egyptian medicine Imhotep and ancient Egyptian surgical practices. Also we will discuss how the ancient Egyptians had knowledge about surgery, obstetrics, and gynecology. So, we explore the fascinating legacy of Imhotep, Egypt's earliest known physician and legendary architect of the step pyramid of Saqqara. This episode delves into the remarkable contributions to medicine and surgery and treating over 200 diseases, as well performing few procedures in the centuries ahead of their time. In this lecture, we discover ancient Egyptian insights on women's health, fertility diagnosis, and innovative surgical methods, which are documented in the Edwin Smith Papyrus, the world's oldest surgical text. So we begin further. Imhotep, father of Egyptian medicine, also called as god of medicine, god of healing, and the era is 2980 BC. He was a polymath, architect, and chief minister to King Zoser. Imhotep, father of Egyptian medicine, was the earliest physician, wazir. Who is a wazir? Executive head of Zoser, founder of third dynasty. He was also called as Prince of Peace. He was an architect to King Joser's step pyramid of Saqqara, Egypt's first pyramid. He was a learned man, an astronomer, a physician, an architect and builder of the first pyramid, the step pyramid of Saqqara, a hero and a blameless physician. The Prince of Peace was a title given for his healing and philosophical stature. He treated tuberculosis, gallstones, appendicitis, gout, arthritis, performed surgery, and practiced dentistry. He diagnosed and treated over 200 diseases, 15 diseases of abdomen, 11 of bladder, 10 of rectum, 29 of the eyes, and 18 of the skin, hair, nails, and tongue. He extracted medicines from plants. He also knew the position and function of the vital organs and circulation of the blood system. He is known as Egyptian polymath, having wide range of knowledge in the ancient times 2980 BC. Ancient Egyptian medicine thus has the spiritual concept of medicine, and it marks the existence of mummies in pyramids and the outstanding contribution of Imhotep, the father of Egyptian medicine. Ancient Egyptians had knowledge about diseases of women, about diagnosis of fertility. Fertility was diagnosed by placing garlic in the vagina for one night. If the next day the woman can taste or smell it in her mouth, she is fertile. Thus, these were quite, you may understand this as a very weird things the ancient Egyptians had. They concluded this based upon the connection between the genital parts and interior of body. Such connection would be lost in case of obstructed fallopian tubes. They had knowledge about diseases of women and diagnosis of pregnancy as well. Sex determination was done. The future baby was based on the fact that pregnant urine germinates cereals more rapid than the non-pregnant one. If the child was a male, the urine would germinate wheat, and if a female, it would germinate barley. The delivery of ancient Egyptian females was performed in squatting position with the women supporting her arms on knees and sitting on two bricks. This picture is discovered on a surviving wall painting. In case of difficult labors, they were aided by burning resin or massaging the abdomen by saffron powder and beer. Abortions were performed by introduction of warm oil and fat in the vagina. Contraception was performed by insertion of crocodile oil, gum acacia or honey corn spurge, that is a sprinkler type, and a natron used in mummification and preservation into the vagina. Gum acacia, when dissolved, produces lactic acid, a very effective known spermicidal. Thus, Egyptians had extensive knowledge on obstetric and gynecology. The women's place in ancient Egypt was quite high. The interesting facts about ancient Egyptian females that they were ahead of their time, had many of basic human rights as men. They could own property, borrow money, sign contracts, file for divorce, appear in court as witness. They had rights in the property of husbands. Thus, women were well treated, enjoyed considerable amount of legal rights compared with women in other ancient civilizations. They were considered equal to men, faced nearly no resistance in the society. Now we try to throw light on practice of surgery in ancient Egypt. The knowledge is acquired from Edwin Smith surgical papyrus. Edwin Smith, the era is from 1829 to 1906. Thus, it was discovered in the 19th century. Edwin Smith was an antique collector who lived in Cairo, bought ancient Egyptian texts and named after him instruments also. Thus, Edwin Smith surgical papyrus, the era is 1700 BC, very ancient time. Ancient Egyptian, the oldest written record using the word brain. It includes 48 cases and injured by falls, maybe from working on monuments or buildings. Victims of battle. Many wounds appear to be caused by spears, clubs, or daggers. The antique pottery fragment is found, indicating the picture of circumcision was performed in the ancient Egyptian times. Practice of surgery in ancient Egypt that is described in the Edwin Smith Papyrus. The suturing of non-infected wound with needle and thread was done. Raw meat was applied on the first day, then dressing of astringent herbs, honey, butter or bread was done. Raw meat is efficient, known to be an way to prevent bleeding. Honey is hygroscopic material, absorbs water and stimulates the secretion of WBC, the natural first body defense mechanism. So the ancient Egyptian had quite advanced knowledge on surgery. They treated piles and rectum prolapse by medication, suppositories, laxatives and enema. For burns, a mixture of milk of a woman who was born a male child, gum and ram's hair was applied. Urethral strictures were dilated using reeds. Mild antiseptics as frankincense, date wine, turpentine and acacia gum were used. Cauterization was done by hot fire drill. The pain elevation to allow surgery was known to ancient Egyptian physicians. Patients were sedated by use of opiates. Local anesthesia was also known, where water was mixed with vinegar over memphite stone, resulting in the formation of carbon dioxide with its known analgesic effect. Thus, these two pictures available on internet, they depict that Edwin Smith Papyrus is the world's oldest surgical text. In 1905, Mr. Smith's daughter donated this artifact to New York Historical Society. Medical treatises was written in 1700 BC, but most of the information is based on the text written around 3000 BC. So, this is the first textbook in surgery. Edwin Smith Surgical Papyrus is the first textbook in surgery. It is sometimes considered as even 5000-year old. Thus, it is a remarkable insight into the medical practice in ancient Egypt. The case scenario format is a problem-based medicine. The birth of analytical thinking in medicine was born in the ancient Egypt. Thus, in this lecture, we saw Imhotep's insights laid the groundwork for analytical thinking in medicine. His name echoed across centuries as a symbol of wisdom, healing, and divine knowledge. Thus, when we hear the name Imhotep, he wasn't just the architect of pyramids, he built the very foundation of medical practice with intellect, empathy, and an enduring legacy. So, this was about the ancient Egyptian medicine. This was the third part of the lecture on ancient Egyptian medicine. So, I hope you have learned the first two parts of ancient Egyptian medicine too. Do comment, share, subscribe, and you can get the knowledge on Organon of medicine from other videos also. Thank you.